This has made it possible for us to conduct the session and do it remotely, and it's worked like a charm.
Dr. Reg Williams is a University of Michigan Comprehensive Depression Center therapist. When the pandemic arose and Michigan's shutdown began, he needed to switch from seeing his patients in person.
If we were in the office, you'd have to have a mask on, I'd have to have a mask on because we'd be too close.
So he started seeing them virtually via video conference.
And it's kind of like you and I talking right now. We're looking at each other, we're discussing issues. This is what I do with my patients all the time, and so it's amazing.
The technology even allows him to share his medical descriptions and recommendations through screen share.
I might draw something like this just to show them what happens in the brain when the patient is having nothing but negative thoughts.
Dr. Williams did not miss a beat. That was a pleasant surprise to his patients.
Reg had sent me an email and said, here's our link to our video conference. And I was like, oh, I didn't know you were doing this. This is awesome.
Because there is a real concern for patients if there is a break in treatment for any reason.
What can happen is they start going back to some old behaviors that really cause them a lot of grief and a lot of problems.
Continuous mental treatment is just as important as physical safeguards like a quarantine.
Keeping them on track, helping them to address what it is that they're struggling with is what therapy is all about.
Dr. Williams feels no lack of quality of care.
Honestly, Andrew, I have not seen any difference at all. In short, it's been the same. We're talking about the same issues that we would have if I was seeing them in person. I always start out with, what is it that they want to work on? And we get right to work, and that's worked.
Same with his patients.
But the actual visit itself was completely normal. It was honestly more comfortable because I had my cup of coffee with me and he was in his living room or wherever he was, a little office at home.
Although patients are seen mostly waist up on video, they can't pull the wool over the therapist's eyes by hiding mannerisms or signs of stress out of camera view.
I don't think I can hide that because I think my tone also correlates with the fidgeting of my fingers and whatnot.
It's the core of the person that you're really dealing with, that you're looking at them and they're looking at you, and that connection that you're making with the person is what really helps.
Also, it's a time saver. If a patient is in psychological crisis, an immediate connection can be made. And for regular sessions, there is no more commute.
It's certainly much more comfortable for them and less time consuming than if they had to drive to the center.
I didn't have to worry about, finding a parking spot in the middle of the building. It was just I eliminated a lot of the external factors.
I've talked with all my patients, how have you found this? Have you found this to be okay? And every one of them said yes, which I think is kind of speaks for itself.
And as far as video visits available to others?
Oh, 100%. Yeah, I think everyone should have access to that. A lot of this is accessible and possible. So yeah, I would love to see it happen in the future, even beyond the pandemic.
If healthcare is smart, they will make this a tool that any practitioner can use.
And that's one of the key things. Video conferencing technology has actually turned into a vital instrument for both the therapist and the patient that they so far enjoy and certainly find useful.
So the one question I would have is that, I've read a lot of studies that show that virtual conversations don't give you the human interaction that we're, programmed to want to engage in. Do you think you still get that sort of sense of, connection when you're doing a virtual therapy session?
Well, what I gather from Dr. Williams himself and his patient is that there was virtually no difference, especially if they already knew each other, because it's still a live conversation.
Right.
Dr. Williams is actually there. The patient is actually there. They're still able to have a relaxed conversation. Doesn't happen to be in person, but you still have the comfort of knowing that someone is there for you and that you're there for someone.
Absolutely. My therapy sessions have been just FaceTiming my mom, but maybe we should all look into this.
I think, too, that isolation and loneliness has been such a big problem during the pandemic for a lot of people. So just being able to see somebody else that you aren't living with is nice.
And having that access to them quickly is also a big plus. So we'll see where this video conferencing goes as the coronavirus crisis abates.
All right, thank you, Andrew. Great story.